Hello, my name is Claudia Hewitt. I'm a student at West Coast University, completing a course in epidemiology and public health. Today, I will be doing a report based on a study entitled Self-Reported Mental Health and its Gender Difference as a Predictor of Suicide in the Middle Age. This is a quantitative study done in order to discover if there's a relation between self-reported mental health and the risk of completed suicide, and to find out if there is a gender difference in the relation between mental health scores and suicide completion. Suicide is approximately the 10th highest cause of death in most Western countries. What prompted this study was that other studies and reports identified psychiatric disorders as mental health risk factors, as major risk factors for suicide, but not much was known about the relationship between self-reported mental health and completed suicide. This study was conducted among a middle-aged population, as most other studies were done on young people, yet middle-aged and older people committed more suicide. Now, some factors that predict suicide are depression, anxiety, alcohol use, smoking, marital status, socioeconomic status, and gender. Suicide is committed more in males than in females. Rates of suicide are 3 to 4 times higher in men than women. And at the end of the observation period, there were 78 suicides among men and 46 among women. The overall suicide rate per 100,000 persons per year was 12 in men and 6 in women. Other risk factors include hopelessness, family history of suicide, loss of relationship, impulsive and aggressive tendencies, and lack of health care, especially mental health and substance abuse treatment. Now, the major techniques used in this study were the Hopkins Symptoms Checklist and the General Health Questionnaire. This research was done in Norway among a population-based cohort of 61,588 men and 69,774 women between the ages of 39 to 44 for an average of 10.4 years between 1944 and 2007. 1994 and 2007. They were selected through health surveys and their response to a self-administered questionnaire, which were screened by a nurse for any inconsistencies and omissions. The data was then analyzed using a 7-item inventory used to measure mental health status. Each item scored on a 4-point scale. 1 equal no, 2 equal little, 3 quite a bit, and 4 very. Data analysis was carried out by the use of the Cox function in R statistical software. The major results of this study showed that the relation between self-reported depression and anxiety and increase of risk of suicide was stronger in males than females. The results supported the hypothesis, as the studies show that depression, which is a mental issue, was identified in approximately 60% of all suicides. The findings of the study were consistent with the worldwide trend where suicide is concerned. It has been noted that men commit suicide more frequently in almost every country, despite the fact that women have a higher reported rate of mental health disorders such as depression, and suicide rates are higher among the middle-aged worldwide as well. Now, these results do point to future studies. Since there is a higher prevalence of mental health disorders such as depression and anxiety in women, yet the suicide rate among men is much higher than in women. Further studies may need to be carried out to find out why this is so. I found this study to be very interesting, informative, and clearly written, and it really had the statistics to prove the results. I am glad that future studies will be done also. Now, I chose this particular article to review because mental health issues is very dear to me, and I work in an institution that deals with patients with mental health issues. Now, these patients, they often commit suicide, try to commit suicide, or even have suicidal ideations. Now, I have seen this firsthand on many, many occasions. One thing that really struck me the most was recently a friend of mine who I grew up with, she committed suicide in my country. She and I are the same age, and she is middle-aged as well. Now, when we were growing up, she never seemed to have any mental health issues, or she never showed that she had any mental health issues, nor did any of her family members that I know. However, I heard that she was very depressed and she decided to commit suicide. This was very troubling because this is somebody who I knew very well, somebody who I grew up with, somebody who I went to school with. This mental health issues is one of the major contributors to people committing suicide because they cannot deal with these issues, especially depression. Mental health issues also affect these middle-aged people, especially depression. Middle-aged people suffer from depression a lot because they cannot deal with all the stresses of life, and not everybody is able to cope with it, and they don't have help. Sometimes they really don't go to seek help, especially males. Males tend to keep all these problems bottled up inside, and they usually carry out the suicide act even more often than women. Women will sometimes talk about it. I have seen in my institution where patients, they have suicidal ideations and they talk about it. These are mainly women, but some of them do commit suicide. I've been a first responder to people trying to commit suicide or seeing people actually commit suicide, and this is very troubling, and I really do hope that more can be done for these patients, because I feel really sad for them because they do not know, they don't have the coping mechanisms to cope with these issues that cause them to commit such an act as suicide. And people really don't understand. A lot of people don't understand what these people are going through. So these studies help us to understand what these people are going through and how it affects them, and probably will help us to really study more and do more to be able to understand these patients, especially people like myself who work with these patients every day. It's very troubling when you go to talk to them and they tell you, oh, I don't want to live anymore, I don't want to continue anymore, I cannot deal with life anymore, and you really don't know how to deal with them. And when you try to talk to them, they say it's easy for you to say because you're not having the problems that I am having, but you want to be able to reach out to them and even do something to help them to be more positive and to be able to prevent them from committing the act of suicide. I really do hope that a lot more can be done to help these patients, and I hope that I can learn more on how to understand how to deal with these patients and how to help them to deal with their problems. Thank you.